Hi. I am going to be talking about the lack of continuity of care when being switched from the mental health unit to the medical part of the hospital when being transferred from the medical part of the hospital back to the mental health unit. So my first taste of the lack of continuity of care was when I was actually admitted to the medical side of the hospital, that I was admitted for my mental health in September 12th of 2021. Um, we couldn't figure out where my belongings that were locked up were, so they didn't get brought down with me from the mental health unit. Which honestly is frustrating because it had my electronics, it had my um, all of my belongings that they would not allow on the unit, and we wanted to have the items brought home so they would be safe here at home. But that wasn't the only thing that was um, lacking, like their knowledge of where they had my stuff locked away. In which case we had to get a patient advocate from the hospital to actually help us figure out where the stuff was. And that's partially why I want to become patient advocate for those with disabilities, is because of this experience that I had with the continuity of care. Um, that I was lacking. So the other part of it was when I was on the medical side of the hospital, they never once thought of having somebody from the mental health, or the mental health part of the hospital come talk to me when I was into the medical side of the hospital. Yes, I was technically admitted to a different part of the hospital, but I was there for my mental health still. And it would have been nice to have had that continuity of care throughout my hospitalization, whether it was medical reasons or mental health reasons. If they just brought down someone from the unit or this hospital social worker or any mental health provider, like, to my room on the medical part of the hospital to see where I was at, to see how he was doing and how he was feeling about being admitted medically, and what I was feeling, whether if I had to be readmitted back to the health side of the hospital and the mental health unit or not. And to just talk through my feelings about things that were going on while I was admitted to the medical side part of the hospital. Like I said, it could have been even as a hospital social worker, like not just to assess to see if I was being readmitted back to the mental health unit post discharge from the medical side of part of the hospital, but like throughout my days when I was admitted on the medical part of the side of the hospital. And then once I was finally admitted back on September 16th, 2021, to the mental health unit, at least I was admitted back to the one I was already on before I was admitted to the medical side of the hospital. But at the same time, it would have been nice to have them bring up the neurologist that I was seeing when I was admitted medically, in that who turned out to be my outpatient neurologist at that time. Um, which obviously you never want to see any of your doctors in the hospital when you're admitted to the hospital for any medical reason. It would have been nice if they brought her or any of the neurologists to the unit when I was admitted back to the unit for my mental health and see how being put back on medications for epilepsy was affecting my mental health. And that didn't happen. So why would I even share with them how I was feeling about being back in seizure meds if I can actually talk to a doctor that I already felt comfortable with about how being put back on the anti-seizure meds was affecting my mental health. Um, so that lack of continuity for my care for the rest of my time on the unit wasn't good either. And like I said before, like I had no like real care on the unit when I was there in September 2021 for my mental health because of being transferred to the medical side of the hospital during the week I was only on the mental health unit on weekends. First, it was September 9th through September 12th. I know September 12th was a Sunday. I, yeah, it was really September 10th through September 12th because I didn't get admitted to the unit until 3 a.m. September 10th. Um, they didn't tell me my diagnosis is like when I was on the unit at all. Like, I didn't find out what they were until after I was discharged and talking with my therapist that I had at that in 2021. Um, that is not right either because if you're being admitted to the mental health unit, they should at least tell you when you're there and being put on meds, possibly for the first time. what meds you're being put on and why you're being put on those meds, what diagnoses they think you have. And I think it didn't, that was another thing that didn't help when I was admitted medically during the week was they didn't have much time to talk to me to figure out if they were giving me the correct diagnosis, mental health diagnosis or not. And that's one thing where the continuity of care would help when being transferred between different parts of the hospital. While admitted, and even being admitted to, even if I was admitted to the hospital originally for my my physical health conditions, like or symptoms, then yeah, like, and they decided to switch me to the mental health unit, it would be the same. I would want the doctor from the medical unit, part of the hospital, to come to the mental health unit to check in on me when I was on the unit, and then like, and then being transferred back to the medical side of the hospital. I'd want the mental health unit staff to then come make sure I was okay, and just to make sure that I wouldn't have to be admitted back to the mental health hospital, mental health unit again. So it just goes both ways with continuity of care, the lack thereof. Like, I'm, if they were talking with each other, why wouldn't they come talk to me too? Like, I'm the patient. It shouldn't just be talk between providers. It should be talk between providers and patient the whole time the patient is in the hospital. And because that's one thing about mental health that gets affected because of your disabilities is you wonder if they really do care about you. Or if you're just looked at as just a number and just as a like patient identification number, not a person. Just as total, complete care um, throughout disciplines. That is all for tonight. And I will talk to you again tomorrow. Thanks. Bye.